Did you know that prostate cancer is one of the deadliest cancers a man can get? According to the American Cancer Society, it is the second most common cancer in men, behind only skin cancer. In fact, 1 in 8 men will be diagnosed with prostate cancer at some point in their lives. In 2024, an estimated 300,000 men in the United States will be diagnosed for the first time, and more than 30,000 will have died from the disease. The good news is, if caught early, prostate cancer is less likely to be fatal. So, it is important to recognize the early warning signs. Let's go through each specific sign together. Signs number 1. Pain or burning when urinating. Do you feel a burning or stinging sensation when you urinate? This is not an old age thing as many people think. When the prostate becomes enlarged due to cancer, it can compress and block the normal flow of urine, causing you to feel a burning or pain when urinating. Not only that, prostate cancer can also invade nearby structures, such as the urethra, bladder, or rectum, making the pain more pronounced and uncomfortable. In some cases, urinary retention due to an enlarged prostate can also cause a urinary tract infection, which in turn causes a burning sensation when urinating. Antibiotics sometimes provide temporary relief, but the underlying cause, possibly related to prostate cancer, still needs to be examined by a doctor to know for sure. Risk factors such as family history, genetics, obesity, and lifestyle can make this symptom more severe. Sign number 2. Frequent night urination. Do you often wake up multiple times at night to use the bathroom? The feeling of having to wake up 2, 3 times, or even more, from a sound sleep is not only tiring, but also an important warning sign. Frequent nighttime urination, nocturia, can occur when an enlarged or cancerous prostate presses on the urethra, preventing you from completely emptying the bladder. A partially full bladder. The brain constantly sends signals to urinate. You have to wake up multiple times during the night. Long-term sleep disturbances can cause you to feel tired, lack energy, and reduce your quality of life. If you find yourself waking up too often, it's a good idea to talk to your doctor. Keeping a bladder diary, recording how many times you urinate during the day and each night, can help assess the severity of the condition. Sign number 3. Blood in the urine. If you notice your urine turning red or pink, or even just slightly pink, this could be a sign of advanced prostate cancer. This condition is called hematuria, and there are 2 types. Microscopic hematuria, blood so small it can only be seen under a microscope. Grand massive hematuria, urine that is so discolored it can be seen with the naked eye. About 3 to 5% of men with prostate cancer may experience blood in the urine. This is because, as the cancer progresses, it can invade the urinary system, such as the kidneys, ureters, or bladder, damaging blood vessels and causing bleeding. Blood in the urine is never normal, and even if it only appears once, it should be checked immediately. Early. Signs number 4. Persistent back, hip, or leg pain. Persistent pain in the lower back, hips, or legs, especially for no apparent reason, is a sign you should never ignore. Prostate cancer, especially when it is spread, can spread to the bones. When the bones are affected, you may feel a deep, dull pain that lasts for days or weeks. Several studies have shown that men with unexplained back pain are at higher risk for prostate cancer than the general population. In advanced stages, cancer can also cause weakness or numbness in the legs due to the tumor pressing on nerves. If you have persistent pain and don't know where it's coming from, it's best to see a doctor right away. Sign number 5. Sudden, unexplained weight loss. If you experience significant weight loss without changing your diet or activity level, this could be a major sign of prostate cancer. Cancer cells use more of your body's energy than normal and disrupt your metabolism. This can cause you to often feel fatigue, loss of appetite, nausea, loss of interest in food. Sudden weight loss isn't always a good sign. It could be a sign that your body is fighting an underlying condition, including prostate cancer. Sign 6. Rectal pain. If prostate cancer has spread to the rectum, you may experience a number of unpleasant symptoms, including rectal pain, constipation, feeling of difficulty controlling urination, gas obstruction, diarrhea, a complete change in bowel habits. These signs are often mistaken for common bowel problems, causing many people to ignore them. But when they appear with other symptoms related to the prostate, this is an important warning. To determine the exact cause, your doctor may order digital rectal exam, DRE, ultrasound, PSA test. Signs 7. Pain when sitting. If you experience pain, numbness, or discomfort when sitting, especially on a hard surface, then it is likely that the prostate has become enlarged due to cancer. A tumor or enlargement of the prostate can put pressure on the pelvic floor, making it difficult to sit for long periods of time and causing pain in the pelvic area, lower back, area between the anus and scrotum. If sitting becomes more difficult over time, you should get checked out early. Signs number 8. Difficulty urination, urinary retention. Prostate cancer can block the flow of urine, causing you to experience difficulty starting the flow of urine, weak or interrupted urine stream, feeling of an empty bladder, straining to urinate. A tumor extending beyond the prostate and pressing on the urethra is the main cause. If not checked early, urinary retention can lead to infection and make the problem worse. Signs number 9. Loss of bladder control. Urine leakage or difficulty holding urine can also be a sign of prostate cancer. The prostate plays a role in controlling the flow of urine, so when you have cancer or after treatments such as radiation therapy, prostatectomy, the nerves that control the bladder can be damaged. About 25% of men have bladder problems after prostate cancer treatment. This is one of the signs that should not be ignored. Signs number 10. Pain during ejaculation. Instead of feeling comfortable, you feel pain when you ejaculate? The pain can manifest in many forms. Sharp pain in the penis, dull pain in the testicles, deep pain in the rectum, pain in the lower abdomen. Some people only have mild pain, but others have severe and prolonged pain. Regardless of the severity, if this condition is recurring, need to be checked. Causes of prostate cancer. Experts say that so far, they are not completely sure what causes prostate cells to become cancerous. But here is what we do know. Like many other cancers, prostate cancer begins when cells in the prostate divide more rapidly than normal. Instead of following the growth, death, regeneration cycle like healthy cells, these abnormal cells continue to multiply uncontrollably. When the number of abnormal cells accumulates, they form a tumor. Over time, part of this tumor can break off, travel through the blood or lymph system, and spread to other organs of the body, a process called metastasis. The good news for you: most cases of prostate cancer grow very slowly, and in many cases, doctors can detect the tumor before it has spread outside the prostate, making treatment much more effective. If detected early, the chance of successful treatment of prostate cancer is very high. Factors that increase the risk of prostate cancer. There are 4 main factors that increase the risk of prostate cancer. 1. Age. The risk increases with age and becomes much more common after age 50. The older you are, the higher the risk. 2. Family history. If you have a close relative, father, brother, etc., who has had prostate cancer, your risk is 2 to 3 times higher than the average person. 3. Obesity. Men who are overweight or obese may face the possibility of prostate cancer being more aggressive and more likely to recur after treatment. 4. Race. According to statistics, African American men have a significantly higher rate of the disease. 1 in 6 African American men will be diagnosed with prostate cancer in their lifetime. How to prevent prostate cancer. 1. Eat a healthy diet. Choose fruits, vegetables, whole grains, and limit processed foods high in fat. 2. Don't overuse supplements. There is currently no scientific evidence that supplements can reduce the risk of prostate cancer. 3. Exercise regularly. Exercising at least 3 days a week helps improve overall health, mental health, and reduces the risk of disease. 4. Maintain a healthy weight. If you are overweight, lose weight slowly through a balanced diet and gentle exercise. 5. Talk to your doctor about your risk. Some drugs, such as finasteride or dutasteride, can reduce the risk of prostate enlargement, but they also have side effects, so you should consult a specialist carefully. Prostate cancer can be treated very effectively, especially when detected early, so don't take regular checkups lightly. In short, prostate cancer is a worrying disease, but the good news is that early detection can be very effective. If you see any of the signs in the video, don't panic. Just get checked to know exactly what's going on. Health is the most precious thing, and taking care of yourself from today is always a wise choice. Thank you for taking the time to watch this video. If you find the information useful, please like, subscribe to the channel, and share so that many others can also gain more knowledge to protect their health. You can also leave a comment below. I'm always happy to hear your opinions, stories, and experiences. I wish you good health. See you in the next video.